So just a quick recap of what this Voice of the Patient Forum is about. It is a kind of meeting called Externally Led Patient-Focused Drug Development Meeting. And this was something originally developed by the FDA to make sure that the patient's voice is part of the information the FDA has when it's making decisions regarding the development and approval of therapeutics. This testimony, it's a formal process. It's compiled in an official Voice of the Patient report that is given to the FDA, and it becomes part of the public record. And initially, the FDA did this as an internal kind of meeting, and it proved to be so popular that they then created a process where patient advocacy groups can propose to hold one of their own. So we sent in a proposal just over a year ago to the FDA, and they approved it, and we've been working with the FDA and with Larry and his colleague James Valentine to prepare for this day. Thank you all for being involved. So who is going to be there on the 29th? Most importantly, you, patients and caregivers. And we will also have people from the FDA and the biopharmaceutical companies, some researchers and nonprofit agencies who will be in listening mode, but they're just there to observe. It's all about you and what you have to say. The agenda looks like this. There'll be some introductions, and then Dr. Catherine Wagner from the Kennedy Krieger Institute will give a background on FSHD in terms of things like prevalence and sort of the medical view of what's known about FSHD and prospects for therapy and so on. So it's just to make sure particularly the FDA folks are listening, that they get grounded in some of the basic facts. Then we move on to session 1, which is focused on the impact of FSHD on daily life. And there's going to be multiple components to this. So we're going to start with panelists who are going to give short, 5-minute statements about how FSHD has impacted their life. You will be able to watch all of that on video on our website. And then that's followed by a live moderated discussion, which James Valentine, whose photo you see there, will be moderating. So he's going to be like a circus master, kind of moderating conversation that's happening in real time on Zoom, as well as phone calls that you can make that'll be coming in, and email comments that are coming in. So the major part of this session is going to be around what you all have to say through these 3 channels: Zoom, phone, and email. Then there will also be polling questions, which will be done live on the website or through your smartphone, and they will relate to the topics that have just been discussed. So you have a chance to vote as well as speak. And it's actually a lot of fun because you can see in real time, you can see the little voting bars moving around as you all vote. Then in the afternoon, we will have a second session. And by the way, there will be a lunch break, so don't worry, there's a break in the middle. In the afternoon, we have session 2, which focuses on treatments, what's going on presently and what you hope for in the future. And again, we'll have a group of panelists that you can watch on video making statements. Then again, a moderated discussion with Zoom, phone, and email, and polling questions, and then closing remarks. So that is what the day will look like. And all of this takes a total of about close to 5 hours, including the lunch break. So just to reiterate, here's what happens. The panelists are patients and caregivers. We chose them based on the diversity of experiences, their age, sex, if they're a patient directly affected or a family member. And they set the stage for the moderated discussion that follows. And that discussion takes place. You can call in. We have a number of people who'll be on Zoom, and you can email in. And all of these things, the phone number, email comment form, it will be on our website that day. And then there's that online poll. Just a little more detail on that. It will be a multiple choice poll. You can vote in it from your laptop, your tablet, or your phone. And the idea there is to capture these key opinions from the community at large. And those poll results will also be in the Voice of the Patient report. So we really recommend, if you want to speak that day or send in a comment, to plan what you're going to say. So and you can pick any topic you want, one or more that you have something you want to share. Stories are really important. Stories are compelling. Don't just make a general comment like I have, pain is a big issue. Bring it to life with specific instances where it has interfered with something in a really detrimental way. That's very compelling to make it very specific, tell your story. So we have in session 1 again, key areas of discussion would be the symptoms and how they've impacted your life. The ones that have really, changed your plans, or you felt like limited, things that you deeply care about. And the other area relating to impact on daily life is, because FSHD is a progressive condition, what are the things that you worry about the future, that the direction this disease can go in, whether it's in yourself or in your loved one, the impact on your family in the future. So think about these things and plan to make as concise a statement as you can about that. And then the second session, as I said, will be on treatments present and future. So many of you are doing things right now to try to address your symptoms. So what are they? How well do they work? What are their benefits and what are their downsides? And you might find that something really works, but it becomes unaffordable, or there's a limited number of people who can provide it, and your provider left your area and now you have no recourse, or all kinds of things can happen. Again, be very specific about these treatments and the pros and cons. And then very important topic, especially for the FDA looking at this, is they're going to be considering new therapies that are being, the companies are coming to them for approval. They need to know, are the benefits of those therapies going to be meaningful to you? So they need to hear from you, what will make a difference in your life? What do you want those treatments to be able to do? And what would it do for you? If you imagine a great treatment, how would that change your life? So I wanted to bring Larry in for a second. If you want to unmute yourself, Larry, if you have anything to add at this point about it, anything I've said so far?
No, I think you did a great job, June. I think the thing that I would like to re-emphasize what June said is that we would really like to have as many people as possible to be participating throughout the entire day. I know it's a big time commitment, but like June said, this is a once in a lifetime. This meeting will happen one time, and then it's going to generate this voice of the patient report that's going to be seen by many, many, many people after the meeting. So we really, like June said, the more people that attend, the more it really shows that your community is really interested in trying to help to find better treatments for people that are affected by FSHD. One of the other things during the actual meeting, you won't be able to join by Zoom. We kind of have some people already selected for that. So one of the main ways that's going to be really important is that we get people to make a telephone call, to call in. And when you dial the number, you'll see the information about how to call in with when you want to participate in the discussion. You might be put on hold. That you just have to wait until the moderator can accept your call. But it would really be helpful to the meeting if folks could phone in so that we actually hear your voice. It's a little bit more interesting to hear someone speaking live than writing, although written comments are also very important. If you're shy or you just, you might have to run and do something. If you want to get your written comment in, please send those too. But both ways are really important, but we would like to get a lot of folks on the telephone if possible.
Yeah. There's a reason we're doing it this way instead of just compiling a big written dictionary. And it's that you have the captive audience, the FDA are going to be there, and there's a whole level of information and emotion and feeling that comes across in your voice that can never come across in writing, unless you're like a literary genius. If you're a great writer, please, I don't want to discount that, but when they hear your voice, and we encourage you to wear your feelings on your sleeve, because that's that really matters, and that lands with people from the FDA hearing it.
Yeah, so yeah, I worked at the FDA up till 2018 in the rare diseases program there. So I got to watch some of the other patient-focused drug development meetings, and then I got to see how FDA used the information. And some of the most important things in the Voice of the Patient report aren't just that you have a symptom, but like June was trying to describe, that you also make a quote about how that symptom impacted your life, and you tell a story. And those are the things that really make, they're very compelling, and they really help the FDA to understand what is the burden of living with FSHD. How does this affect people? I always found that when we were doing a drug review and we were looking at a Voice of the Patient report, that sometimes it was the quotes, and all of your quotes will be quoted directly. We're going to record the meeting for the whole day, and then it will be transcribed. So if you say something, if you make a quote, it will be in the final report as a transcription.
Thanks, Larry. Okay, so moving right along. So what's going to happen? On the morning of June 29th, you're going to receive an email from us with a link to join the live webcast. And when you click on that link, you're going to land on a page where you'll be asked to sign in, and then you'll be directed to the page where the video is embedded right there, and I'll show you what that looks like in a second. If you don't receive one, please check your junk mail folder. I have to check my junk mail folder every day because there's so much actual mail that gets stuck in there. So that's number one. Number two, if for some reason you don't get the email, we have a back door or a front door actually right on our homepage. Right now, you'll see this thing that says Join the Voice of the Patient forum. If you click there on the day of, it will take you to the registration page. And you can also get there from our regular navigation. If you go to the Get Involved area, mouse over that, you'll see this menu open up. Voice of the Patient forum is on the bottom right corner. Click there and it'll take you to the page as well. So what it's going to look like on that day is you see our familiar Voice of the Patient banner at the top, and right below there's a form that says live stream registration. So yes, I know you've already pre-registered for the Voice of the Patient, but on the day of, this is how we track who actually attended. And that's, very useful data for us. And so it's a really simple form. Just fill it out, submit, and it will take you to this page, which I'm sorry it's so small, but gives you the overview. At the very top, there will be a video embedded, and I think you can click on it to start playing it. Right below it is the agenda, so you can see what the day looks like and figure out when the lunch breaks are and so on, and who's coming when. Below that, very important, is that second blue button under there is going to be a link to the live poll system. So I strongly recommend that you click on that right away and get yourself set up to start participating in the polls. Below the poll link is the phone number, so the phone in live, and there's the number going to be there. And then below there is a form that you can submit your comments via email. So phone or email, whichever you feel most comfortable with. As I said, calling in and people hearing your voice has a big impact. But if you're not comfortable with that, by all means, use the email comment. All right, so I guess this just reiterates what I just said. Start the webcast, view the agenda, connect to the poll, call in a comment, submit your comments by email.
Yeah, one thing, just to mention about the polling questions, the very first polling question will be just some demographic questions like, how old are you? Are you male, female? Where do you live in the country? That kind of thing. And if there's anybody who's on the call today that's a caregiver that's going to, for someone with FSHD, you'll just be answering all those questions for the person with FSHD. So,
right. So when you do click on the poll link, you're going to be directed to a page that looks like this. I think there might be a little button that says, do you want to be notified? And if you, when there's activity, and click yes, you do, because you might be on one web page looking at the live stream, and the poll page might be open in a different tab or window. And I think if you say be notified when, for example, when James says, let's go to the poll, it'll alert you so you know to go over to the poll window, or it'll alert you on your iPhone. So it's a useful thing to make sure you're up to speed on all the activity going on. All right, so that's the live poll. Just to reiterate, oh yes, testimony can be submitted in advance as well. So if for some reason you're not available on the 29th, you can go ahead and visit our Voice of the Patient landing page. And right now there's a form that says email a comment in advance. And those comments that are submitted in advance will also be part of the Voice of the Patient report. We might read from some of them, and especially at the beginning of the discussion forum, if people are, it's taking a little while for people to write and send things. Some of these comments that are sent in advance would be very helpful to us, because it provides us material we can share with our live audience during those first few minutes when we're waiting for other comments to come in. And just to reiterate, register for the meeting on that landing page if you haven't done so already. There is a link, pollev.com/FSHD, where you can make sure that you have the poll system kind of, I think there's an app for iPhones, and you can download it and make sure you're ready to go. If you have any questions, email vopf@fshdsociety.org. If you have testimony that you want to submit in advance, you send that to comments@fshdsociety.org. So I'll make this slide deck available again on our Voice of the Patient forum landing page. So Larry, do you have any other?
No, I think you covered it well, June.
All right, thank you so much. So also you can reach out to Jamshid Arjaman, myself, or Beth Johnston with further questions. And we look forward to seeing you on June 29th. So let's see if there's questions now. Question is, will virtual attendees be able to start logging in several minutes before the actual start time? Yes, you will. I think that page, we're planning to have it go live certainly by midnight on Monday. So anytime that morning, you'll be able to log in, get yourself set up, and wait for the live stream to begin. All right. And let's see, there's some things in the chat. Let me see if there's anything. Oh, question is, what is the start time? The live Voice of the Patient forum live stream begins at 10 o'clock a.m. Eastern time next Monday, the 29th. And then another question, will you be asking questions directly to caregivers to get their perspective? Larry, do you want to answer that one?
Sure. So if a caregiver is representing someone, they are an equal participant in the entire meeting, that we really want them to be involved. So when we have panel 1 and panel 2, there'll be, like as June said, there's going to be a section that's just about discussion. And that's where we will ask people to either call in or to email a comment. And we absolutely want caregivers to be calling in to share the experience that they can talk about the person that they care for. That's actually a really important, and we've done this for some other diseases, and sometimes the caregiver input is some of the most important input to the meeting. So yeah, so I hope many caregivers, participate as well.
Yeah. I have a question here. Just to reiterate, can we submit our story via email as well ahead of time? And yes, the answer is yes, you can. Thank you for that. I'm sorry. Do we have to sign up to speak during the meeting? No, you don't. If you want to phone in, I think the only process is really a very simple. There's this little form you fill out just to say, I'm here today. That's all there is.
Yeah, one thing for people calling in, as you're listening to the meeting, the moderator, James, is going to ask some very specific questions. So the phone calls that they'll be letting go live are the ones that are addressing those specific questions. So please don't call it, if you call in with a general comment that's not really related to the topic, you're probably going to be put on hold. So try to keep, on target with what the discussion topic is. Yeah,
that's a good pointer. Yes. And also we will, we hope our switchboard will just light up, and we will do our best to get to every question and caller, but we can't promise because we have a time constraint. But that would be a good problem to have. So we would love to, just call in. All right. Anything else? No, looks like we're good. And as I mentioned before, we're all available to answer any other questions you might have offline. All right. Thank you so much. Thank you, Larry, for being here today.
Hey, look forward to it.
See you next Monday. All right. Thank you all.
See everybody then. Yep. Bye-bye.
Bye.